Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about two signs that we see in meningitis, and these are the Kernig sign and then we have the Brudzinski sign. Now, why are we talking about meningitis in ENT? That's because meningitis is actually one of the most common intracranial complications that we see in cases of chronic otitis media, even in cases of acute otitis media. So, this is a condition that we should be knowing about, and we should know about these two signs that will help us in catching these diagnoses, because then it'll become a complicated case of chronic otitis media and our treatment towards it will change. So that's about it. You can also now purchase my notes. I've added links in the description. Okay, so let's understand these two signs. Our first sign over here is the Kernig sign. Now, what happens over here? So, Kernig sign is basically what you're trying to do here. How will we elicit it? First, let's talk about that. So, the patient will lie down supine and you'll flex the hip of the patient at a 90-degree angle, and then you will attempt to extend this knee. So the knee is in a flexed position right now. We'll attempt to extend the knee. Now, when you do this in a normal patient, what happens is you'll be able to normally extend the knee fully. In case of meningitis, we will see a positive Kernig sign, which means when you try to extend the knee, there will be pain in the lower back area of the patient, or they'll have a resistance towards this movement that you're trying to do, or you'll just not be able to extend the knee at all. And that is what Kernig sign is. What is the reason behind it here? So when you're trying to stretch here, the inflamed meninges will be causing a lot of pain. So when the hip is at this flexed angle and you're extending the knee, this ends up stretching the sciatic nerve and the inflamed meninges. And that's what will lead to pain and spasm, preventing the full knee extension of the patient. That's what is known as Kernig sign. Now, this is a sign which was named after Vladimir Kernig, and he was the one who described this sign in patients with meningitis. So, this is very important for us to know. And there's another sign that comes along with this, and that is the Brudzinski sign. Now, before we go there, I'd like to talk about a simple mnemonic to remember this. How do we remember what we see in Kernig sign? So we'll remember the two letters K and E. K and E from Kernig sign, right? So K is for knee and E is for extension. So in Kernig sign, knee extension is painful. So this is what we see in Kernig sign. And I have a small MCQ question here. Can you tell me what is the CSF finding that we usually see in case of bacterial meningitis? That's a very common Viva question. We'll see an increase in the neutrophil content, a decrease in the glucose content, and an increase in the protein content of the CSF in case of meningitis. So that's about the Kernig sign. Let's move on to our next sign, which is Brudzinski's sign. Now, what happens here? So Brudzinski sign, let's talk about how are we going to elicit this. So the patient will lie supine and the examiner will gently flex the neck forward. And as you try to do this, the neck flexion will end up stretching out the meninges. To reduce the stretch and the pain, the patient will reflexly end up flexing their hip as well as knee. This will indicate that there is a meningeal irritation over here. So Brudzinski sign is basically the involuntary hip and knee flexion of the patient when you try to flex the neck. So this is what is Brudzinski sign. And this was named after a Polish pediatrician called Józef Brudzinski, who described this particular sign in patients of meningitis. Now let's talk about another mnemonic over here to remember what is Brudzinski sign. That is, let's remember the mnemonic B. So B is for Brudzinski and B is for both hip and knee getting flexed when the neck gets flexed. So that's how we are going to remember about Kernig sign as well as Brudzinski sign. That's all for today. I'll see you in my next class. Thank you.